Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How long does gonorrhea last? Gonorrhea is a sexually transmitted infection, STI, caused by the Neisseria gonorrhea bacterium. It is one of the most common STIs in the United States, causing 1.6 million new cases in 2018. With appropriate treatment, the infection usually clears quickly. /r/n/r/n Gonorrhea is spread through sexual contact with an infected person. Symptoms include painful urination, urethral discharge, rectal bleeding, rectal soreness, vaginal discharge, pelvic pain, and rectal discharge. However, many people with gonorrhea do not have symptoms. /r/n/r/nTatsiana Volkava Getty Imagesrnrn Gonorrhea symptoms can clear up quickly, often in as few as 2 to 4 days. In most patients, symptoms resolve within 1 week of beginning treatment, but it may take up to 2 weeks. Symptoms may clear faster in males than females. /r/n/r/n While most symptoms typically clear quickly, some may take longer. If you experience pelvic or testicular pain, it can take up to 2 weeks for it to resolve. /r/n/r/n It is unlikely that your body will clear gonorrhea on its own, and symptoms are likely to remain until the infection is treated. /r/n/r/n Untreated gonorrhea can cause several health complications. While gonorrhea is treatable at all stages, the health complications that can occur, such as scar tissue development, may require additional treatment. /r/n/r/n How long treatment lasts depends on the type and route of medication your provider prescribes. For example, they may prescribe oral antibiotics that are taken for several days. Or, treatment may be short, requiring only 1 injection of an antibiotic given in the healthcare provider's office. /r/n/r/n Your healthcare provider can help you understand your treatment options to determine the right one. /r/n/r/n Avoid any sexual activity before beginning treatment, during treatment, and for 7 days after treatment ends. Additionally, partners of an individual who tested positive for gonorrhea should also be treated or tested. /r/n/r/n It can take time for a gonorrhea test to become positive. If the exposure was within 60 days of symptom onset, the partner may receive presumptive treatment instead of waiting for a potential exposure to test positive. /r/n/r/n If the potential exposure was greater than 60 days from symptom onset in the partner, then a provider may choose to perform STI testing first. /r/n/r/n Since gonorrhea often occurs with other STIs, such as chlamydia, your healthcare provider may test you for additional STIs and treat them as indicated. /r/n/r/n If you are still experiencing symptoms after treatment, contact your healthcare provider before resuming sexual activity. Some gonorrhea strains are resistant to treatment, and you may need a different medication to clear your infection. /r/n/r/n This video has been medically reviewed by Jamin Brahmbhatt MD/r/n/r/n Gonorrhea is treated with antibiotics. The preferred antibiotic used by healthcare providers is ceftriaxone. The Centers for Disease Control and Prevention, CDC, recommends gonorrhea treatments based on the patient's weight, /r/n/r/n If someone has a cephalosporin sensitivity, high-doseazithromycin with gentamicin is recommended. /r/n/r/n Gonorrhea infection in the throat can be difficult to treat. Therefore, the CDC recommends that anyone with throat or oral gonorrhea return in 7 to 14 days after the first treatment for a follow-up test. /r/n/r/n If you test positive for gonorrhea, talk with your healthcare provider about retesting in 3 months. This is done to ensure an infection has cleared or to detect reinfection. /r/n/r/n A ceftriaxone shot, the most common treatment for gonorrhea, is a cephalosporin antibiotic. The most common side effects include /r/n/r/n Antibiotic resistance has been an ongoing problem with gonorrhea treatment. Resistance means that the gonorrhea bacteria has changed over time to adapt to antibiotics, sometimes making it harder to clear. /r/n/r/n Gonorrhea treatment typically relieves symptoms within 1 week. Contact a healthcare provider if you continue to have symptoms 3 to 5 days after treatment. Continued symptoms could indicate that the treatment didn't work. /r/n/r/n Gonorrhea may not disappear because of failed treatment or reinfection. A healthcare provider will determine the best next steps if treatment is unsuccessful. Anyone can be reinfected if they have sexual contact with someone who has gonorrhea. /r/n/r/n If gonorrhea goes untreated or does not respond fully to medication, it can cause serious health issues, such as /r/n/r/n The CDC lists several ways to prevent STIs. STI prevention measures include /r/n/r/n Gonorrhea is an STI caused by a bacterial infection. Treatment with the antibiotic ceftriaxone is usually successful at treating gonorrhea. If you do test positive for gonorrhea, consider telling your partners so they can receive testing and treatment. 2. /r/n/r/n Adequate treatment typically resolves gonorrhea symptoms within a week. If symptoms persist 3 to 5 days after treatment, or you have concerns about your treatment, contact a healthcare provider for advice. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.